Hi everyone, I welcome you to this live session. This is Dr. Sandeep Sharma here. So before the INI SS exam, a lot of you requested, sir, some last minute tips. So don't worry, it is going to be a live session, but it will also be a very crisp session. Most of the things I'll be telling you, you already know, but some of the important suggestions from my side, end of the day, you never know what small little advice can work in your favor. So I'm going to have this session where I will be talking about the so-called final sprint. INISS 2023 session we are targeting. So it basically pertains to the exam which is going to be held this year, and the session obviously will start from the next year in the central institutes. So what are the points, what are the things, what are the suggestions from my end? Good afternoon, Arpit. I hope you are doing good, Arpit. So what are the suggestions from my end? First, I'll talk from my end and then I will be taking whatever doubts, if you have any, I'll be taking them. So first of all, one quick revision is mandatory. Whatever is your level of preparation, whether you feel your preparation is inadequate or you feel your preparation is rightly on the track, 1 week before the exam, you should quickly have a look at whatever you have read, whether it is a strong area or a weak area, because what we have seen, what people say always is that whatever you see in the last 1 week, if it is a strong area, it increases your confidence. If it is a weak area, it increases your chances of recall in the actual exam, right? So one quick revision of both strong and weak areas is mandatory before the exam. Second is focusing on the high yield but missed areas. If you look at the past papers, some of you might have given the INI-SS exam in the earlier this year and the previous one before that. You would know that there are areas from where questions are very repeatedly asked, especially in the general pediatric part. There is always one or two questions asked from acid-base imbalance. There are one or two questions asked from the usual graph-based. There will be one graph showing pressure volume curve in a particular condition. They may ask you a normal curve. They may ask you a curve in ARDS. They may ask you a curve in severe asthma and so on. So all these things which are important, frequently asked, but you have a tendency to neglect, please go through them once. Also, other than acid-base imbalance, the electrolyte disorders are very important. All the named procedures are very important, and the emergency part, like if a patient is, you have to intubate a patient, how you are going to do the rapid sequence intubation, or what are the drugs which you will be needing or not needing during intubation of a child or an agitated child. Such kind of basic things which have been asked in the past, please have a look at them in this last 1 week or 10 days before the exam. Thirdly is focusing on the AIMS protocol, because the time now will be limited for you. So focus, if you are targeting the neonatology part, then AIMS neonatal protocol have to be read. Secondly, you should be focusing on the AIMS PICU protocol also. AIMS PICU protocol, the time to read them cover to cover is gone. So selectively, the acid-base imbalance, the head injury part, you can have a look for general pediatrics, and whatever specialty you are targeting, have a look at the specialty related part as well. Don't try to read the introduction part. Look at the definitions, look at the criteria, look at the investigation of choice, look at the boxes which are given in the PICU protocol. If you haven't read the 2022 protocol, the older protocol will also work. So last minute, please do not try to change your track. Another important thing regarding protocols is that yes, protocols are important, but in case you haven't read them, it will make sense for you not to start anything new at this moment, right? Fourthly, complex congenital heart diseases are very important. In fact, from whatever crude recall I could get in the INISS previous exam, there were about 7 to 8 questions in general pediatrics from complex congenital heart diseases. There were 2 questions on TAPVC, one clinical scenario based question on duct dependent lesion where you had to start prostaglandin. Then there was a ECG based on a normal child. There was a ECG image of a complex congenital heart disease, and then there were match the column kind of question on the shunt procedure performed or a named procedure performed and the corresponding congenital heart disease. So there were options like Glenn operation, modified Fontaine operation, etc. and Norwood procedure and the corresponding diseases. They had asked which is the correct match or which is the incorrect match. So please go through complex congenital heart diseases based upon the past paper. See, if not even a single question is asked, nothing can be done about it. But all we can do is in the last few days before the exam, we can focus on the trends which are being asked. So these are the trends which I am telling you, because the past recall papers are not available, unfortunately. And genetics part, please focus on the usual Mendelian inheritance, genomic imprinting, and also have a look at the how to make the diagnosis from the pedigree charts which are given. Often you will find AIMS people are very fond of pedigree chart. They will give you a pedigree chart. It will not be as simple as you might think, but they will ask you directly which is the mode of inheritance, or they may ask you which among the following disease can follow this pattern. So you should know what is the kind of pattern and which among the following disease is having that kind of pattern. For example, they may give you an example of a Marfan syndrome or a autosomal recessive condition like cystic fibrosis. Marfan is dominant, cystic fibrosis is recessive. So you may have a pedigree chart and you will be asked what is the likely disease in the patient. So these kind of things, you should be mentally prepared for them. Fifth thing is examination strategy. When you sit in the exam, please understand that if it is a difficult paper, if it is a atypical paper, it is going to be atypical for everyone. Every exam, particularly INI SS exam, in the general part as well as in the specialty part, there will be unsolvable questions also. Those questions should not, make you panic in the exam. Mark whatever is best possible and mark whatever is likely. Just because it is INI SS exam, so answer will be atypical, please don't go by it. I actually have a message from one of the rankers who eventually got through in NEET SS. He messaged me saying in the previous INI SS, one of the question went wrong because I was like, इतना आसान कैसे पूछ सकते हैं INI SS के अंदर? आसान पूछते हैं, easy things are asked in the exam. So every exam there is a mix of easy, difficult and not so difficult and some tricky conceptual thing. So here also you will find similar things. And in the general pediatric part, there are 1 or 2 questions asked from biostatistics part also. There are 1 or 2 questions asked from the pregnancy part also. They may be asking risk factors, high risk pregnancies. They may be asking maternal factors affecting children, a particular condition. Like in the previous INI SS, there was a question related to the physiological changes in pregnancy which affect a fetus. So that kind of a question, you can't read right now, but if you have read before, just make sure that you go through those notes. And if you have to, really have a look at something, Cloherty, the initial few chapters are good enough. Don't go into unnecessary details, or Nelson, or for that matter, any hi-fi standard textbooks. The time to read hi-fi standard textbooks is gone. So these are the few suggestions from my end that I can share with you. Please go through the ECGs, the common ECG patterns, the recent AIMS protocols, and also again a small suggestion, guidelines for and cutoffs for neonatal hypoglycemia have recently been changed in this month itself. From IAP, October 2022, there is a new update where slight changes in the working threshold definition and the management cutoffs for neonatal hypoglycemia have changed. We don't know whether it will be asked actually in the exam or not, but for this exam and for the next NEET SS exam, please go through it once so that you know what is the difference between the older guidelines and the new guidelines. Differences are not much. You can simply Google it. You will find it. If you are unable to find it, do let me know on Telegram or Instagram or email, whatever the place. So these were some of the suggestions from my end that I wanted to share with you. I haven't looked at the messages coming from your end. So let me see and answer. If you have any queries, please let me know. So Mukul is asking, why no PGI seats this time in neonatology, sir? Dr. Mukul, I have no idea. Absolutely no idea. Arpit, how much to attempt minimum out of 80? Yes, a very good question, Arpit. Arpit, you might have given the exam earlier, or you may have heard that the score in the exam is very close. And if you are targeting AIMS exam, then you also have that departmental assessment thing coming. So it is always important to attempt on the higher side. When I say higher side, that does not mean that you attempt all 80 out of 80, but somewhere in the range of 72 to 75 should be the attempt based upon what the rankers say. If your attempt is only 60 out of 80, frankly speaking, even if you have made 1 or 2 questions wrong, still the chances of selection will go down because the absolute crude score has to be high. So attempt somewhere above 70, I would say. If it is a very tough paper, maybe 68 to 70, 72 you can go. If it is a easy paper or a moderate level paper, up to 75 you should be targeting. on the higher side. Adapt according to the exam conditions. Good afternoon, Neeraj. Anish is asking, good afternoon, sir. Any suggestions for pediatric neurology? Anish, time is very limited in pediatric neurology. If you look at the past papers, neuromuscular disorders very frequently asked, neuroregression disorders very frequently asked. If you open the chapter of neuroregression, the encephalopathy part in Nelson, there are tables given where they say if neuroregression is present with hepatomegaly, neuroregression present without hepatomegaly. Read that table. Most of the things you would already know, but if you read that table from Nelson, it will be a quick clue. So if a clinical scenario is asked in the exam asking related to neuroregression, metabolic disorder, you will be able to solve that. In fact, there was in NEET SS, the question on Krabbe's disease. If you would have read the description mentioned there, you would have easily solved it. So please go through that. Additionally, in neurology, they do ask about the fibrillation potentials also, or a couple of years back, there was a question on NCV graph also was given and assessment. Nobody knows how to read a NCV graph if it is a complicated graph. So don't waste your time in the last moment. Accept it as a unsolvable question. But neuroregression, pediatric epilepsies, febrile seizures, spinal muscular atrophies, muscular dystrophies, all muscular dystrophies are important from your exam point of view. Then also, before I forget, you have a live test going on right now. So please give the mock exam. It is free of cost at the PrepLadder app. Download it. If you are a subscriber or you're not a subscriber, it is a free mock test. Please register and give it so that it will be a good practice for you before the exam. Secondly, it will help you in revision and time management. And thirdly, you will solve some MCQs so the monotony will be broken up. So if you haven't given the exam, please give the exam. Free का कुछ नहीं छोड़ना चाहिए और exam और mock test तो बिल्कुल नहीं छोड़ना चाहिए, but you should have the time for that. Doctor, past papers for INISS unfortunately are not available. Whatever recall I have, it is based upon what individual students send to me. I am working on making them into a comprehensive kind of thing, but that is going to take time. So unfortunately for INISS, there is no past recall papers available in the market. Arpit is asking biostats and various plots of PSM, how much time to be given? Arpit, time is limited. End of the day, not many things are going to be asked. So read them superficially, the expected things you should be focusing on. What topics can be relatively omitted from general pediatrics? Arpit, focus the usual things like severe acute malnutrition or short stature and the classes of short stature, constitutional delaying growth, height velocity, growth velocity, patterns in them. That you have to read. That has to be read. But the older classifications, fine points of nutrition, or I would say adolescent problems, you can leave. Tooth eruption, sequences, if you remember them, fine. But if you haven't read them, you can omit those parts. Micronutrient deficiencies is important and it should be read. End of the day, only 1 or 2 questions will be asked, but rickets is very important. Vitamin deficiencies are important. Atypical things like zinc or copper or manganese or magnesium deficiency or molybdenum deficiency can be omitted at this last moment. Arpit, milestones at least bare minimum you should read. Because what is happening is, if you ask your seniors or if you have given the exam before, milestone less questions are being asked these days. In fact, there have been a couple of papers where no questions were asked. But milestone is like a thing, if you prepare it very well, there is a possibility question will not be asked. But the moment you decide, okay, I will not read milestone, you will find a question there. So at least the bare minimum important milestones you should be reading through. So any other queries from your end? Genetic disorders are important. Screening procedures are important. For major diseases like phenylketonuria, alkaptonuria, methylmalonic acidemia, homocystinuria, what is the screening investigation? What is the investigation of choice? And what is the therapy of choice? With a quick accuracy, it should be there for the important genetic and metabolic disorders in your mind. Doctor, I've just told you about the past papers that past papers of INISS are unfortunately not available in the market as far as my knowledge goes. But whatever things I say, similar question was asked, it is based upon recall messages. What students say, I keep taking snapshot and I make a medley out of it. So I say it from there. So I hope all these suggestions which I have shared with you, you will benefit from it. So please like and subscribe the channel if you haven't already done. And once the exam is done, whatever the exam was, please share the recall, because only then we'll be able to come out with the recall discussion also, and that will be benefiting you in NEET SS also. And if you plan to take the exam again, that time also we'll get more insights into the exam at that moment. So Sagar is asking, sir, could you please brief on important topics in pediatric hematology and oncology? Sagar Reddy, if you look at the past papers, let's first talk about hematology. Inherited bone marrow failure syndromes are very important. Differential diagnosis of your microcytic hypochromic anemia is very important. किसमें आपका your TIBC is rising, किसमें serum ferritin, what is happening to that, etc. Right? The 4 causes and their differential diagnosis. Thirdly, thalassemias, their inheritance is very important. Fourthly, sickle cell complications are very important, like sequestration crisis, acute splenic crisis, how you are going to manage them, how you are going to manage the bone pain in them, etc. Clinical as well as management part. Then you should be focusing on the platelet disorders. In platelet disorders, ITP is seldom asked. You can have a look at the ASH, American Society of Hematology guidelines, the quick summary part, ASH 2019 guidelines on ITP in children, because questions are asked from the boxes given there. In addition, you can have a look at the hemophilias. There is always a simple question in hematology or oncology related to, if you are targeting hemato-oncology, you will have questions from calculation of factor deficiency, factor 8 and factor 9, how much amount is required. So the formulas given in Nelson are important. They may ask you the causative agent of hemophilia C, hemophilia B, such simple questions, but they are asked in the exam. Types of von Willebrand disease is important. INISS does ask questions on von Willebrand disease, and it is something we don't read properly. If you have time, go through the table given not only in Nelson but also in Harrison, because questions have been asked from that area. And other than that, bone marrow transplantation, that is important. What else? Oncology part, yes. Oncology, solid tumors are very important. So you have neuroblastoma, Wilms tumor, related syndromes. Wilms tumor and neuroblastoma prognostic factor, always asked in exam. If it is not asked this time around, it will be a surprising thing. Again, it's no guarantee, but you have to be thorough with the prognostic factors of neuroblastoma, Wilms tumor. LCH, when you read LCH, please also go through HLH syndrome. Questions have been asked in general part also and in the specialty part also. Also go through this leukemias, the FAB classification, although it is outdated, but still it is asked in the exam. Prognostic factors. Don't go into the unnecessary details of the protocol treatment regimes. However, the major protocol में difference क्या है? So BCOP regime में कौन से drugs included हैं? At least you should be clear. Where it is used, it should be clear. Most effective drug in Langerhans cell histiocytosis, it should be clear. It should be clear in your mind that you are going to use your cladribine, you are going to use, and you're going to use vinca alkaloids for Wilms tumor. So such basic things should be clear in your mind regarding the therapeutic part. However, don't overdo the therapeutic regimes. This is related to hematology oncology part. Anything else? Arpit Swane, which infection would you say shouldn't be? Arpit, very difficult to say. Before the exam, HIV is important. Tuberculosis, the IAP RNTCP tuberculosis part is important. In case you are running short on NACO guideline part, for the NEET PG aspirants and in general, I am going to put up a small summary of feeding guidelines and HIV in mother and child. The NACO 2021 update summary I am going to put up on YouTube channel. So before you sit in the exam, it will be put up in the next couple of days. Please, mostly on the weekend. It will be a 20-minute video. Just go through it once. Ideally, you should be reading the HIV part in details. Thirdly, You should not miss out on COVID, obviously important hai. In the previous INISS, there were two questions related to Kawasaki disease versus MISC if you have given the exam. So please read COVID infection and its complication. How do you differentiate from Kawasaki disease? Then leptospirosis, the usual things which you find. Rickettsial infection, before I forget. Rickettsial infection is extremely important for the exam. Having said that, any infection can be asked in the exam, so you can't really prepare. Vaccine preventable diseases, viral infections, measles, mumps, rubella, chickenpox, uh, although it's not vaccine preventable, but Zika virus and congenital infections also you should be reading thoroughly. Congenital infections. Karthi is asking, sir, will there be any differences between DM and DNB pediatric cardiopulmonary to future process? Please kindly enlighten. Karthi, as I said before, if you see from superficially, DM always has a slight edge over a DNB. That is how the system operates. Having said that, if you are a DM and your skills are poor, if you, on the other hand, you are a DNB from a prestigious institute and your skills are good, you eventually do better than the DM person. So it all comes down to the skills involved and also where you intend to practice. If you intend to practice, frankly speaking, except for the first few weeks, DM versus DNB will not matter. If you want to work in a corporate setting, if it is a big corporate town, like for example, you are going to work in Chennai or Bengaluru or Hyderabad or Mumbai or Delhi, one seat and four people coming, one DM, three DNB, the DM person usually gets preferred. That's the harsh reality. But if you are sitting in a smaller center, or if there are multiple things in multiple seats there, you are DNB. There are people with DNBs who do excellent, and in fact, DNBs sometimes have better exposure related to private practice because many of the DNBs are in semi-governmental organizations. So their exposure to the various skills is sometimes better. So it all comes down to individual. And other than that, end of the day, you are super specialist. All these degrees can only, give you a push. Eventually, it comes down to how good you are and what place you are sitting. Tanmay Verma, according to past years, some of the topics from core, critical core cases, my humble request. Yes, Tanmay. Tanmay, point is, all these will not be possible immediately. They will be a part of the new update which we'll be putting up. So I've told it before in session also that neurology new videos, now I am recording, and I'm also recording the rapid revision parts of these super specialty videos. So in those rapid revision parts, I'm trying to incorporate the areas which were not there or missed out in the detailed videos. So point taken, point taken. Tanmay, yes, I know you have been asking for long. You have sent messages also, but Tanmay, as I say always, not everything is in my hand. A lot of things have to be decided as a team from the management point of view, whether it is feasible to put it on the app or not, and whether I am suited to put it on the app or the previous videos have to be continued. So we have to see a lot of things. But yes, all these points are taken and we will be putting up. In fact, I have already done a lot of recordings in the recent weeks. So I think the session is done. I've taken your doubts also. So let's keep it short. Exams are approaching. Give your best shot and don't miss out on the things which I missed out on. This entire video, the recorded part, will also go up in a few minutes on YouTube channel. Whatever topics I have said, do not miss out on. Make sure that at least 10-minute look you have on those topics before you sit in the exam. Question may or may not be asked, but you will be more confident कि expected भी नहीं आ रहा, so it will be a more level game for you, right? So all the best for your exam. And once exam is done, please do share the recall. If not the entire question, at least how was the paper and what are the topics from where questions are being asked, so we can tackle those things before your NEET SS exam also comes. Thank you very much. Thank you. Bye bye.